So, Fawn, we're so happy to have you with us today on Let's Talk About Your Breast. And just tell us a little bit about your background, where you're from, where you've lived.
Oh, goodness. I'm a lifelong Texan.
Which is very, very unusual.
Yes, I know. I can't imagine living in any other state. I love to travel, but Texas is home. So I grew up actually on the southwest side of Houston. So down in the rural areas, closer to the coastline, hugging right against Houston in the Rosenberg area. And when I met my husband and married my husband almost 20 years ago, we actually moved to College Station. So I've been in the Bryan, College Station, Brazos Valley area for over 20 years now.
And now you live in a different city.
I live in a tiny little town about 40 minutes outside of Bryan College Station. So I live in a very rural area. Our town is so small, we don't even have a red light.
Oh, my goodness. And
Yes.
it's called?
Iola.
Iola.
Yes.
I remember you talking about that, and I'm thinking, not even a red light. Oh,
Not even a red light. It's tiny.
And you went to school? Where?
I did. So I attended, of course, all my regular schooling in Southwest Houston. But I am a proud Bearcat. I went to Sam Houston State University in Huntsville, Texas for my undergrad. And actually, right now, I'm not sharing this with many. Now everyone will know. I went back to school, and I'm working on my master's.
Oh, how wonderful.
Yeah. Life finally slowed down just a hair, just enough for me to just add something else to my plate. So it's been a grand adventure so far.
And now you've been in a community benefits role for a long time.
Yes.
And how the heck did you get into that?
Oh, gosh. Well, when I was in school, I really thought I was going to be in the fitness industry. I was a personal trainer. I studied health and kinesiology, exercise science, and I thought it was my passion, but there was always something missing. It was kind of a rat race. It was who could get the most customers, who could charge the most, things like that. At least that's how it felt to me at a young age. And I remember taking a family and consumer sciences class as just a general elective. And then I took an environmental justice class, and I was hooked.
Oh, my.
And then I took a family psychology course, and I was done. I went and changed my major to community health, and I found that little piece of something that was missing, that community, that full health, wellness, mind, body, spirit connection that you don't get with just the fitness industry.
No, not at all.
Yeah.
And that's so encouraging for anyone who is still trying to make their decision on what they're going to be when they grow up. Mm-hmm. It's interesting how people get into this field.
It is. I've mentored over 20 undergrad community health interns over my career. And I tell all of them, I know, they're wonderful.
Let's see, how
but
did
it's
you
a job.
find time for work? Yeah.
Yes. And they were all full-time students where they had to complete a full 3 months full-time unpaid internship. And I tell all of them, it's never too late to change direction, to find your passion.
And why are you passionate about this?
That's a great question. I started with a great example from my family of service to your community, service to others. And it was something that I was always interested in. I wanted to be the helper. And I think that's where it started.
Okay.
Yeah.
So now you're going to have to put together for our listeners what Common Spirit is and how it works within the community. And I mean, you're like the grants officer of this. Is that a good
for our
way?
area?
Yes.
Yeah. So Common Spirit is the large organizational name of all CHI, Catholic Health Initiative hospitals, and Dignity hospitals. So on two different sides of the country. About 3 years ago, they came together and created one Common Spirit. And in the past, this grants program, as you mentioned, was only offered on the other side of the United States with our Dignity hospitals. And now all of the Common Spirit or community CHI, Catholic Health Initiative hospitals, are offering it as well. So this is our first year to offer this awesome program. And I am the steward, if you will, of all of the grants that were handed out in Texas. So our 16 Texas hospitals for St. Luke's Health under Common Spirit.
So this was a fascinating concept to me because the hospitals have a say in this about who receives grants. They are in their communities and know what's missing. So that is is that a standard thing in most of granting processes? I've never
Generally,
heard of that.
no, and that's why the program is so exciting. And it's a way for us to truly live out our mission outside the walls of our hospital.
Okay, tell me the mission.
So we are a nonprofit hospital system, and I won't say it verbatim because
sure.
I'll probably get it wrong, but it truly is about meeting the needs of the most vulnerable, driving health equity, and leading with mission in all decisions that we make.
Okay, I have so many questions under that umbrella.
I know.
But first, let's describe the communities you're serving primarily.
So it's a really mixed bag. There are some really dense metropolitan areas like Houston and the Texas Medical Center, but we also have a lot of rural areas with critical access issues that drive all the way down to the coastline in our Brazosport area to Pasadena and the Woodlands and up in North Houston. It's a very large geographic area with a lot of underserved people.
And, that's something that so many grant reviewers really can't get their heads around, that we are so large. There's so many miles between. And that really makes a difference in access to care.
It really does. Texas has a unique issue with that. Everything is so far apart, right? We don't describe things in miles. We describe things in how long it takes to get there because everything is so far away. Access to care is a huge issue in Texas. And so as a nonprofit hospital system, we do a community health needs assessment every 3 years. It's required by the IRS, but it was actually started by Catholic Health Initiatives before it was ever an IRS requirement. They were already doing this. They were already looking at their communities, surveying their communities. It started with the sisters. They went out into the community and asked, what do you need? Where are your gaps? How can we serve you? I know, it gives me goosebumps when I think
it
about
does me too.
So, 100 years ago, they were so far ahead of healthcare.
Right. And, I'm going to say this, and I'm not, this is a very general statement, but many, many times we are asked, the Rose is asked something during a community assessment by some of the nonprofit hospitals. But I've never known any that actually put that into practice. Like, how are we going to partner? How are we going to be something more for our community? And I think it's not just let's check the box and we did our community assessment. I think with the Common Spirit, with all the hospitals under you, they have a different approach to that altogether.
They're trying. They're trying. We can't solve it all on our own in silos. So this grants program is a huge undertaking, a huge effort to do more than just check the box.
Right.
How do we genuinely collaborate with those providers in our community that are doing the hard work outside the walls of our hospital? We're all serving the same patient population. Even if they don't walk through the walls of our hospital, if the community gets better, we all win.
We all win. And so the Rose is a provider for screening, mammography, in many of these outlying communities. We are home-based in Houston. However, our 5 coaches go to 43 different counties, and we have seen the difficulty in women having access to care for this. I mean, many of the counties that we go to don't even have a mammography center. They don't have a breast center. And many of those that do don't have 3D mammography, which is a huge difference in how mammograms are done. And it really makes a difference in having that 3D technology. But what I discovered the most was, of course, we serve an uninsured population as well as an insured. But in rural communities, it didn't matter. The insured have just as much trouble getting to where they need to be as the uninsured. And the other thing is, you really don't know where the poverty lines are. It's not like in the city. And that surprised me so much. We've spent so many years here in this urban area. We know where the pockets are. But then when we'd go out to these more rural areas, it was fascinating. And really I don't know what the word is, but a discouragement in how little we've moved forward in some areas. It was like, really, this is a basic healthcare need. And that's a huge issue in many of those communities.
So the Rose, your organization received several grants.
Oh, we did. We were so delighted.
It was
oh my gosh.
5 grants across our entire service area. And your organization was selected because of everything that you bring to these rural areas. So as we know, transportation is huge. So access to care, most of them don't have a lot of providers in their community, and especially not specialty providers.
Right.
Within a 30 to 60 mile radius. It's almost unheard of in most of our critical access areas. And you bring that to these populations. It's so incredible. It's so impressive. You are driving out the mission, literally, in our communities. You're driving our mission.
I like that.
So we're so happy that we could partner with you in this way, this first year of our grant cycle.
And we were too. We were amazed. And, I know how you reached out to us when we didn't even know anything about Common Spirit. And that's unusual too. I mean, you were actually asking those questions within the community about who do you partner with. And what a difference this grant has made in our ability to reach women. These grants have made. And, I was going to ask you, how do you decide? I know I know that hospitals have interest and have a say, but at the end of the day, it comes down to the leaders, the officers.
It does. It does. Well, I can tell you with the invitation list, this was not a commonly known grant. It's our first year. So what I actually did was I went back to our community health needs assessments and I reviewed who were those key stakeholders in the communities that actively participated in these interviews, where we were looking to find out where are the gaps in care, what are the people saying that they need. And those were the first people I invited to apply.
Ah, interesting.
Because it shows that there's a vested interest, a vested partnership, and a willingness to work with us, and that you're serving that population that we're trying to reach. So next year, it might be an even bigger pool of people applying, but you have to walk before you run. So we kept it relatively small, but also looked at who are the organizations that we've previously partnered with before, who are the organizations that we know do great work in our community. I'm sure some were missed this first year, but that was how we started.
That's it. Oh,
was who are those people that have already participated in these needs assessments that we know are working with the population we want to reach.
That is so important to have that understanding. Now, you live in a small town.
I do.
Tell us a little bit more about that. About the access issues, not just transportation. It's not just that. It's more.
It is, and it's a mentality. If you've ever lived in a rural area, you know that looking at healthcare and how you access it, it's a completely different viewpoint because it's not right around the corner. So you have to prioritize your needs, and especially if you are under the poverty level. Do I pay for my medications this month, or do I pay my light bill this month?
Right.
There's much bigger questions being asked.
And like you said, there's so many services that are not easily accessed or not there. A lot of people don't know this, but we have a country place in Caldwell. And living there, I have learned, it takes you 25 minutes to go get groceries, much less go to the doctor. You just don't do it. And when there is a medical emergency, you better hope you have a small rural hospital that can at least stabilize you. Some communities don't even have that.
It's true.
So, yeah.
And an ambulance might be 45 minutes away.
45 minutes
if they're on the
away.
other side of the county
Right.
on a call already.
Right.
Yes, I don't want to say it's like the Wild West, but in a sense, it kind of is.
Well, it kind of is, yeah. And, if you have an accident, you're just going to hope that you can fix it, and you're not going to go to urgent care because there isn't one.
Yeah.
It's been a very different education for me, and it's also been one of, independence. You know, we're not going to talk about issues. We're not going to get into healthcare discussions. Where that's not always the case in the urban communities. There's a lot of talk about it.
There is. And there's the strength of community, church community. So
Which is sometimes not in the urban areas, yes.
Right. So it's a different way to look at it. So with rural healthcare, you know, there are huge organizations that are trying to meet that need in the way that they need it, because you know, it's not a cookie cutter approach.
So describe that a little more.
So let's say you have a small clinic in a rural area. Does that community trust the provider? Does the provider look like them? It's different. There's different considerations to be taken. People say, well, we don't have access to care. And you tell them, well, you have a doctor 10 minutes from your home in a small clinic. Oh, but we don't want to go there. So it's just, it's a whole different bag with rural health care.
Right. Well, you know, we've had our mobile program since 2006. And it wasn't until probably 2017 that we were starting to be invited into some of the rural areas. And I think it just took that long for folks to know we were there to stay, we were going to come back the next year. And that's so important in screening. If you don't do it routinely, it doesn't have the same life-saving abilities as if you just do it every now and then. And, you know, so much of what we found with especially with our screening is that's when you catch it the earliest. And it can make such a difference in treatment.
Yeah, trust is a big hurdle.
Now, you know, when we were at the ceremony for the awards, I was surprised at how different the organizations were that you were supporting. Everything from community-type outreach for children to something like the hospitals. Tell us a little bit about that.
So in the area you were at for the grant celebration, that's in the Brazos Valley. So they have a 9-county service area. And that area actually received more grant applications than any other of our areas for our Texas hospitals. So that area has a lot of organizations and a lot of service providers, more than most. So it was a whole mix of different types of grants that were sent in. And they chose some from all the way from transportation for the homeless to get them to medical appointments, to the Rose with mammography screenings, to one organization was starting a community garden.
Right.
Yes.
Right.
So they are, in that organization specifically, we know that they are in a food desert. And it has been a designated food desert for many years. They don't have access to fresh, healthy food. They have to drive over 30 miles to get to it. And the way that their application was stated, it really was to work for community collaboration, bringing that community together with their leaders and their community. So when we looked at all of these grants, you asked earlier, how did you choose?
Right.
And a big part of it was, or the two pieces, the most important pieces were, are these organizations working towards these identified needs that we've seen in our needs assessments that we're also working towards? Access to care, mental health, preventive practices, and chronic disease. But also, what were their measurable outcomes? How are they going to show that they moved the needle? And those applications that were able to truly show measurable outcomes, most of those rose to the top.
I was so amazed at how the different organizations may have just had a couple of people with an idea that somehow got the community around them, and then the next thing you know, they are operating in a very small way, but a big way because they're in multiple communities. That surprised me. I was so fascinated by how much of a network there really is within the different communities. They know where to find this help and how to talk with each other.
So a big part of that, you mentioned what are some of the special issues that rural areas have with healthcare and how are we addressing it? And these very organizations that you mentioned a lot of them are part of the health resource centers that we have strategically placed in that area. And it's a landing zone for service providers to come to that community. They may only be there one day a week, but it's bringing that service to them so they don't have to travel. Everything from signing up for WIC and SNAP benefits to domestic violence counseling to making sure that they are getting screened for food insecurities and access to healthy food with food banks. It's a whole gamut of services. And a lot of those people that were sitting in that room that received grants are part of that network of resource coordination.
Right. Now, we toss around this word food insecurities all the time. And I've started to see it be on a lot of different physicians' questionnaires.
Yes.
But explain that to us and explain what questions are asked to know whether or not that patient really does have a problem.
Generally, the questions are pretty simple. Have you had access to food in the last 30 days consistently? Questions like that. Are you able to have, and with food insecurity, it's generally, I want to say it's 5 questions that they ask. But it's finding out, have they had consistent access to food for themselves and for their family?
Right. Did they have to skip a meal or were they worried about where was the next meal coming from? And I know the same kind of questions can apply to healthcare, but that seems so basic to a lot of people, but it is not.
So mentioning that, it's healthcare, it has its struggles, it has its issues, but I feel like it is going in the right direction in that they're really trying to focus on social determinants of health. There's a much bigger spotlight on that coming from many directions, from healthcare itself, from Joint Commission and CMS standards and hospital standards. They want everyone to start looking a little bit deeper.
That's so important now, and that's a huge nationwide effort that is coming down to the different communities. This has been talked about for a long time.
Yeah.
It is so rewarding, so gratifying to see it actually being put into action. And I think it's most seen in the rural areas. I know that you work with both, so and you can't be prejudiced, even though. Why do you love living in the country?
Oh, it is that sense of community. It's less busy. You have to look out for each other. There's a lot of reasons. We talk about, my children grew up in the city, quote unquote, in the city, the first few years of their life. And now we live out in the country and we talk about it often. What are the benefits of each? They both have their benefits. But we have decided that we are country people. We are. But you're right. We have to plan strategically if you want to go to the doctor, to the grocery store, for an appointment of any kind. You have to plan around it.
Right.
Is my car in working order? Do I have money in the bank? Do I have gas in the tank?
Is this the weather that I need to be out working in? I really do understand that now. I used to tease about all you talk about in the country is weather. And now I understand that it plays a big role in whether or not you can do certain things. It's a concept I don't think many city folks really could get if you've never seen it working.
Yeah, for sure.
Yeah.
For sure.
One of the most interesting things that I was reading about you was, besides the different grants and things, but the CPR kits to the school. That just fascinated me. How did you even know they needed it?
So in the role that I'm in right now as a grant steward, that's a relatively new role and it's a new program. In my past life, we'll say, for 14 years in the Bryan College Station area, my job was really more involved with hands-on education, with CPR classes and new parent education and diabetes education, injury prevention programs. So it's that being involved in your community and having those conversations and networking and finding out what they need. And if we can meet the need, we will.
Right.
And that was just one of my favorite moments that I had to share with you. That was actually during the pandemic. We had to take our masks off to do that interview and then put them back on because we were in the schools. Everyone had come back. And Bryan ISD, so Texas has mandated that all students have to learn CPR before they graduate. Mm-hmm. That's a very loose mandate.
Oh.
Have they touched a mannequin? Has it been talked about in class? Or did they actually learn how to do...
And it's not easy to do at
how
all.
to do life-saving rescue skills. So we found out that Bryan ISD was in huge need of some CPR kits at the time. And we worked with our partnership with the American Heart Association to make it happen. So it's not what you know, it's who you know. Who are those relationships that you've built? And we worked together to make it happen, and it was just wonderful. The students were so excited in their health programs, and the administrators were so excited. It was just a little moment of positivity and light to bring some injury prevention to our students.
Especially at that time.
Yes.
Oh, my gosh.
Yes.
And I just thought that was such a great example of, knowing the community and working with it. And, there's an understanding there that you just help, that you don't, it's just part of what you do.
Mm-hmm. And hospitals, I think they really do. Healthcare is getting a bad rap these days. Mm-hmm. But hospitals, at least I know the hospitals I work for, they really do want to be that source for the community. More than just healthcare. We're all in this together. We're all a part of the community together. They want to be involved.
Oh, yes.
That
is so important.
They do. They do. And it makes going to work on the hard days a little bit easier, knowing that you work for an organization that actually cares.
Mm-hmm.
Yeah.
When you were saying that at the Grants Award presentation, I thought, oh, that sounds good. Is this real? But then the more that I explored Common Spirit, the hospitals, and of course, I had firsthand knowledge of St. Joseph when my husband had a heart issue.
Oh, really?
And it was like, I was amazed at every single person that walked through that door said, what else can I do for you today? Mm-hmm. Is this common? Is this the norm of this hospital? And it was. It was so personal.
Yeah.
So focused on the patient. It was really a different experience. So
they'll be glad to hear that. That is their goal.
Oh,
that
yeah.
is their goal.
Oh, yeah. It was, and being from the city and knowing that, I kept thinking, oh, we need to get him to Houston. I am so glad we didn't. So glad. I mean, he had first-rate care, like you said, with people who really did care.
Yeah. They're from that community. They live there. Their family may be down the hall in another room.
And I remember one of the first things after the surgery, the doctor said to him, now you can't get on your tractor yet. And it was like, oh, that's not something he would have been told here. Everyone understood he had a tractor, he's going to get on it, and have to give him permission. So
that's so funny. I love it. That's a great story.
All right, so if you had to describe Fawn, how would you describe her?
Oh, gosh. Well, as long as I don't have to answer in third person. I don't have a pocket answer for you of how I would describe myself. I want to help people. I want to lead with grace if I can. I'm very empathetic. It's always been, I feel like, one of my strongest characteristics. I can put myself in someone else's situation or shoes, hopefully, and understand where they might be coming from or what they might be experiencing. Don't judge.
Right.
Don't judge others. But I do love what I do. I get to work with the communities as much as possible. I get to help our hospital figure out a way to reach outside the walls and meet those needs. Every day is different.
And that's...
It is.
Yeah.
It is. And I get to, at the same time, I get to be a wife and I get to be a mom.
So how do you take care of yourself?
Oh, probably not as much as I should right now, but I do love to exercise. I love to read and watch movies, and I love music, and my kids play sports, and try to put down the pen every once in a while, turn off the computer, be active.
Be active.
Be active. It's good for your mental health, not just your physical health.
Right.
Try to foster those relationships that I have with family members that I still have and with friends. So we all need self-care.
We all need self-care.
I know it's a hot button word right now, but it's so true. We need self-care.
I was thinking about your traveling and all the things you had to do with your job, but Yeah, I could tell you put that pretty high on your list. No matter what, at least it's on your list.
Yes, it is. It's on my list.
And that's a good message for any woman.
It is. It
Yeah.
is. We have to take care of ourselves so we can take care of others.
Right. And I will tell you, you're doing a great job of taking care of a lot of others. And we are so delighted to be a recipient of the Common Spirit Awards. Thank you for being with us today.
Thank you for having me. I'm so excited to see where this relationship goes and what you're able to
Yes.
do and just push your mission out just a little bit further.
Oh, thank you.